There are over 300 people living with HIV/AIDS here in Ghana. As the world marks HIV/AIDS Day, the World Health Organization is calling on global leaders to confront the inequalities by ensuring equal access to HIV medication. We'll be talking more on this because there's a huge figure that the country needs to deal with, and especially with the infection rates. Let's have a conversation, and in the studio joining me is Dr. Kofi. He's a medical doctor. Good to see you, Doc.
Thank you. And
Johnson Kuranting, who is also a person living with HIV, has also joined me in the studio. It's a pleasure seeing you, Johnson.
Thank you.
Great. So let me start with you, Kuranting. It's always good to share some experiences. How have you been dealing with the stigma, for instance, with living with HIV/AIDS?
Okay. It's not easy though, but we're coping. Because, you know, in Ghana and in our community nowadays, people are refusing education. You try to talk to them and they are like, no, what they said, the myth, what I heard, that's what I accept. And they don't want to accept the truth. That formerly, there wasn't any treatment for HIV. So when you are HIV positive, you can pass airborne diseases and other infectious diseases to many other people around you. But now that there's treatment, people are living with HIV. Myself, I tell people and they are like, no, it's not true. And it's not easy when you are in the midst of people and you want to disclose. It's not easy. The stigma is so great. They are like, you are promiscuous, you are this, you are that. And the mode of transmissions are, you know, in a different ways. You can get it in a different way. It's not just being promiscuous. Yes.
Dr. Ode, how big is the problem, or how serious is the problem of stigma, the problem we're trying to deal with as far as people living with HIV/AIDS is concerned?
Okay. So, like Johnson rightly said, indeed, the stigma of HIV is still a very big problem in this country. And indeed, it's one of the reasons why we are still not achieving control of this epidemic. The reason is that something that people don't have much knowledge or they don't understand, they tend to fear. And I will say that even though we are still educating people and telling them about HIV, there's still a lot more work to be done.
Okay.
People still think by touching someone, you can get the HIV infection by using the same plates, cups, spoons with them. Even sitting on the same seats with them, you can get the virus. And so education, 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 which I keep stressing is the key. If we can throw more light on this virus and send the word out there that yes, even when you have the HIV virus, fortunately, the government has made it possible for us to get medication. And so a lot of people are actually having the virus and living their very normal lives. And if we go this way, indeed, it will reduce the burden of stigma, because the stigma drives them to hide because they don't want to be discriminated in any way. And it's hampering our fight against this virus.
I was very happy that, Johnson, you talked about the fact that you don't have to judge people because it's not everybody who got it who is promiscuous or who has led a bad lifestyle. Are you kind enough to share with us how you got to know that you've contracted the virus?
Okay, so I was a peer educator myself, and I have been organizing outreach programs, which I once organized, and then I have to test by myself, and I did, and then I got to know. It wasn't easy, but I have to, you know, people are looking up to me as a peer educator. They come to me and they are like, I'm infected, what do I do? And I have to lead them to the facilities for treatment, and then myself. So what do I do now? I have to hold on and then fight for myself and then get to this far.
It's quite interesting. Now, when the COVID-19 pandemic broke out, one of the things that we're told were that there were a certain category who were vulnerable to the disease, and the people living with HIV/AIDS are one of those who are in that category. How did you deal with that? Were you ever infected with COVID-19?
No, please.
You never had it. How did you cope with that situation?
Okay, so with the COVID-19, we had persons living with HIV are part of those with underlying conditions.
Yeah.
So for me, I was very careful of myself. I know when to go out, what to touch, who to hug, who to even shake hands with. And then try to observe all the COVID-19 protocols. Okay, and then we just heard we have to take the vaccine. And so I went and then take mine, and then I'm cool. Vaccine. Yes, there are people out there who have been calling me, Johnson, so we persons living with HIV, are we part of, even today, most people call me, I'm like, yes.
Are you part of those going for the
vaccine? Okay. Yes. You have to go, because our immune system has already been compromised. So we have to take the vaccine. Yes.
All right. So, Dr. Odoi, we've been struggling to actually reduce the rate of infections. Where are we now?
Okay, so let me say Ghana has done well over the years in terms of trying to reduce the burden of HIV. And this has been seen in our prevalence having a downward or stable trend over the last 3 to 5 years. Okay. And currently our national HIV prevalence stands at 1.68. It's not just that, but the government has also put policies in place, like making sure this time when you go for antenatal, if you are pregnant and you go for antenatal, they definitely test you for HIV. And the moment you are picked up, or the moment you are positive, they start treatment. Okay. So we've had quite some good coverage over there. In terms of UNAIDS target that they gave to their member countries, which is the 95%, 95%, 95%. Okay. And by explaining, they mean 95% of the population who have the virus know their status, 95% of them who know their status are on treatment, and then 95% who are on treatment are virally suppressed. That is where we still have a lot of work to do. I think currently Ghana, we are at 58, 77, and then 68 in that order. Okay. So there's still a lot of work to be done. But there have been some pluses. For instance, like I was saying, with the pregnant women who transfer to their children, because this time it's mandatory that they test for HIV, we have had a coverage of, well, I think, over 70%. And hopefully by 2023, we would have achieved the 100%. But there's still a lot of work to be done if we are to achieve the 95%, 95% target.
Some time ago, I mean, we were told that, I mean, it's unprotected sex, number one, that is accounting for the spread. Yeah. And so you go to places and you're giving free condoms. And nowadays we don't see that. But I just want to find out, what is it still unprotected sex that is leading the factors accounting for the spread?
Yes, yes. So there are other methods, like you have rightly mentioned, but still unprotected sex, it's leading. Okay. So of course you can have it by use of sharps. If one person has it, and a sharp object pricks him, and then pricks you as well, it's possible you can easily get the virus. When the mother has it, he can also transmit it to the child. And then the not so common ones, like through blood transfusion or blood products. But by and large, unprotected sex is the main way by which most people are getting the virus.
Johnson, in your own case, were you able to detect how this happened to you?
I think it will be through sex, unprotected sex.
Okay.
Yes.
So when this happened, did you reach out to your partner to also try and test and see whether, I mean, she could also contract the disease?
Yes, she did. And she was also positive.
She was also positive.
Yes, she's now on treatment. She's fine, and everything is fine with us.
Oh, wow, interesting. Of course, so that is where, earlier I mentioned that now we don't see more of the awareness creation, the condoms that you go for. Everywhere you go, you get free condoms and what have you. It looks like the drive has died. Some time ago, we're told that the donors have stopped giving us money. What's our situation right now?
Okay, so when you mention money, for that one, you
so it has to do with funding.
Globally, yes, yes, the funding is needed. But for me, I think we should also look beyond the funding. In fact, we should start looking at this as a shared responsibility for us all.
Okay.
I have said that sometimes the only time you see that awareness on HIV is only on 1st December. But you agree with me that the moment we finish 1st December, the next thing we are preparing for is the festivities. People are going to meet their partners, people are going to have fun, get drunk, enjoy themselves. And very often, this advice we may have today may be thrown out of the window by then.
Okay.
So for me, we need the media. In fact, the media is a very important stakeholder. If we can highlight HIV at least quarterly or twice a year before the main day itself, I think the message will keep on ringing in people's ears. Because now people use a lot of smartphones, so there's a social media presence. There's also the opportunity to use the TV platforms like yours, which a lot of people listen to. Yes. So the funds is a problem, but funds is a problem everywhere in the world now. And of course, with the advent of COVID, you can only imagine. So we should look at it or approach from it as from a stakeholder's point. All of us hand in hand, let's help to reduce this epidemic.
But what's your own plan? What's your plan to help deal with this?
Okay, so I work with West African AIDS Foundation. We are a local NGO with a local clinic on site. And I cannot mention West African AIDS Foundation without mentioning people like Eddie Donton and Dr. Na Ashley Van der Poy. Perhaps they are the only couple who I have known in this country who have been fighting HIV over the past 20 years. And we provide services not just in the treatment of HIV/AIDS, but also in the treatment of TB as well. And then we provide general services as well. But the West African AIDS Foundation also provides preventive medicine. So we also do outreaches, we do counseling, we do outreaches for people in the marketplace, we do them in schools. We have actually a mobile van clinic where we go to places that are not easily accessible. We get there, we test them for HIV, and for those that are positive, we treat them. We also provide counseling services as well. And we've been doing this for the last 20 years. Yes, so that has been our way of contributing. We still continue to do it and work in hand with partners as well.
Johnson, what's your message to the public, especially towards the how people stigmatize people living with HIV/AIDS?
Okay, so to the public, I want everyone, every human, to understand that this is human immune. Human, the word H there is human, not stones and not trees. So anyone can be infected. So you stigmatize me today, tomorrow you will be with me in my counseling room and you can't look into my face.
Yep.
So stigmatization, shame, denial, discrimination, we end it now. And then now, there's PrEP, there's ARV, there's PEP for prevention and treatment. So if you are HIV positive, go for your ARVs. If you are negative, go for your PrEP. If you think you are exposed to a person living with HIV, go for your PEP and leave.
Okay.
Use condom, live life and live it well.
And these medications you're talking about, there are people who think that it's difficult to get, especially because the drugs are very expensive. Where can they get it? If, I mean, there's a person living with HIV/AIDS, how do they get these treatments?
So, as Doctor was saying, West African AIDS Foundation, we have a clinic, which is International Healthcare Center, which is part of we work hand in hand together. It's a sister something. So you can have all your services there at the clinic. Yes, whilst the West African AIDS Foundation will be doing their counseling, will be doing the education, the sensitizations, and the rest. You can have all what you want from the clinic.
And you don't have to pay for it?
They are free, yes.
Right?
Usually a token. So where when I say a token for our services, of course, when you come, you are in a nice air-conditioned environment. We have televisions, very nice ambience. So sometimes something very, very small, most of the time. But to add to what he's saying, the government has also come out with policies where you can also go for free medication within public hospitals. So once you have your insurance, you're entitled to free testing and free medication as well. Yeah.
I'm grateful for your time. Dr. Odoi is a medical doctor, and I've also been speaking with Johnson. Odoi Kofilabi is the name. He's a medical doctor. Johnson Kronting is a person living with disability. Thank you so much for coming.